You know that feeling when you're trying to do everything right for your health. Eating well, maybe getting some exercise, listening to advice. We all want to feel our best as we get older. We want to keep up with life, enjoy time with family, maybe travel or pursue hobbies. But sometimes, in our quest for better health, we might reach for something we think is helping, like a supplement, without realizing it could actually be causing problems. It's a painful reality that something seemingly simple, found right there on a pharmacy shelf, could quietly interact with our medications, worsen an existing condition we didn't even know about, or just not be right for our changing bodies. The truth is, our bodies handle things differently as we age. What was fine at 40 might not be the best choice at 65 or 75. There are certain supplements that are really popular. Everyone seems to be taking them. But they can be surprisingly risky if you're over 60 and not completely aware of their potential effects or interactions. Think about the medications you might be taking, even seemingly harmless ones. Now think about adding a supplement on top. Sometimes that mix is fine, but other times, it's like mixing two chemicals that shouldn't go together. In this video, we're going to talk about 3 specific supplements that many people over 60 take, often without a second thought, but which you absolutely should discuss with your doctor before you start or continue taking them. It's not about scaring you. It's about empowering you with knowledge to make the safest choices for your unique health picture. Watch to the end, because what you learn could truly surprise you and potentially save you from some serious health headaches down the road. Let's talk about the first one that pops up for so many of us, especially when we start thinking about keeping our bones strong and sturdy: calcium. Often paired with vitamin D. It seems like a no-brainer. Right. We hear about bone density decreasing as we age. The risk of fractures goes up. And calcium and vitamin D are the go-to nutrients for bone health. Doctors often recommend making sure you get enough. And for many, a supplement seems like the easiest way to do it, especially if they feel they aren't getting enough from their diet. You see the commercials, you see the bottles lining the shelves, promising strong bones and reduced fracture risk. And it's true. Calcium is essential for bone structure, and vitamin D helps your body absorb that calcium. For younger individuals or those with specific deficiencies, these supplements are often safe and effective. However, for those of us over 60, the picture gets a little more complicated. And taking a calcium and vitamin D supplement without talking to your doctor first can sometimes lead to unintended consequences. One of the biggest concerns is the potential for interactions with other medications that are common in this age group. For instance, if you're taking medications for heart conditions, like certain types of blood pressure medication or diuretics, high doses of calcium can sometimes interfere with how those medications work or even affect your heart rhythm. It's not a guarantee it will happen, but the risk is there. And it's a risk you really want to understand with your doctor. Another crucial aspect is kidney function. As we get older, kidney function can naturally decline to some extent. Kidneys play a vital role in filtering waste and regulating mineral levels in the body, including calcium. If your kidneys aren't working as efficiently, taking large doses of supplemental calcium can potentially lead to too much calcium building up in your blood, a condition called hypercalcemia. This can cause symptoms like nausea, vomiting, frequent urination, excessive thirst, constipation, and, in more severe cases, it can affect brain function, cause kidney stones, and even damage the kidneys themselves. It's particularly risky if you already have a history of kidney stones or impaired kidney function. Your doctor can easily check your kidney function with a simple blood test and advise you on whether a calcium supplement is safe for you and at what dose. Furthermore, there's been ongoing debate and research about the link between calcium supplements and cardiovascular health. Some studies have suggested a potential increased risk of heart attack or stroke with calcium supplements, particularly when taken in high doses, compared to getting calcium from food sources. While the evidence isn't entirely conclusive and is still being researched, it's another layer of concern that makes it imperative to have a conversation with your doctor. They can help you weigh the potential benefits for your bones against any potential risks for your heart, taking into account your personal health history and risk factors. They can also determine if you even need a supplement in the first place. Many people can meet their calcium needs through diet by including dairy products, leafy greens like kale and broccoli, fortified plant milks, and fortified cereals. Your doctor can assess your dietary intake and, if needed, recommend the appropriate form and dose of calcium and vitamin D supplement that is least likely to cause problems. They might even suggest getting your calcium levels checked periodically if you are on a supplement. The point is, it's not just a simple vitamin. It's something that can interact with your body in significant ways, especially as you age. So, while the idea of protecting your bones is absolutely important, reaching for that calcium and vitamin D bottle should always start with a conversation with the person who knows your health history best. Your doctor. It's about ensuring that the very thing you're taking to help yourself isn't inadvertently creating another problem. Now, moving on from thinking about our bones, let's consider something that many people turn to for joint health, heart health, and even brain function. Now, let's talk about something that many people swear by for everything from heart health to brain function and easing those joint aches: omega-3 fish oil supplements. You see them everywhere, promoted for their anti-inflammatory properties and benefits for cardiovascular health. And it's true that the omega-3 fatty acids, EPA and DHA, found in fish oil are incredibly important nutrients. Getting enough omega-3s from fatty fish in your diet, like salmon, mackerel, and sardines, is widely recommended and beneficial for some people, especially if they don't eat fish regularly. A supplement seems like a sensible way to ensure they're getting these important fats. Many older adults take fish oil hoping to lower their risk of heart disease, improve their cholesterol levels, or reduce inflammation associated with conditions like arthritis. However, just like with calcium and vitamin D, taking fish oil supplements, especially in higher doses, isn't without its potential pitfalls, particularly for those over 60, and definitely warrants a discussion with your doctor. The most significant concern with fish oil, especially as we age and potentially have other health conditions, is its effect on blood clotting. Omega-3 fatty acids can have a mild blood thinning effect for some people. This might be a desired outcome, contributing to better blood flow. But for others, particularly those who are already on blood thinning medications, combining the two can be dangerous. Common blood thinning medications, also known as anticoagulants or antiplatelets, include things like warfarin, Coumadin, aspirin, clopidogrel Plavix, and newer ones like apixaban eliquis or rivaroxaban Xarelto. These medications are often prescribed to prevent blood clots in people with conditions like atrial fibrillation, a history of stroke or heart attack, or deep vein thrombosis. Taking a fish oil supplement on top of these medications can significantly increase the risk of bleeding. This could manifest as easier bruising, nosebleeds, or more dangerously, increased bleeding during surgery or even internal bleeding. Imagine you have a fall, which is more common as we age. If your blood is thinned by both medication and fish oil, the resulting bruise or internal injury could be much more severe, even if you aren't on prescription blood thinners. If you're taking over-the-counter pain relievers regularly, such as ibuprofen or naproxen, which also have a mild blood thinning effect, adding fish oil can compound that effect and increase your bleeding risk. Before any surgery, even dental procedures, doctors often advise patients to stop taking blood-thinning medications and supplements like fish oil for a certain period to minimize bleeding risk. If you're taking fish oil without your doctor knowing, you might not get that crucial advice, putting you at risk during a procedure. Furthermore, some fish oil supplements, especially those that aren't purified properly, can contain trace amounts of heavy metals like mercury. Although reputable brands usually minimize this risk, still, accumulating heavy metals is a concern, particularly for older adults. High doses of fish oil can also cause digestive issues like burping, often referred to as fish burps, nausea, and diarrhea, which can be particularly bothersome. Your doctor can help you determine if a fish oil supplement is right for you, based on your specific health goals, existing medical conditions, and all the medications you are currently taking. They can advise on the appropriate dosage and form, or perhaps suggest alternative ways to achieve your goals, like dietary changes. They can also monitor you for any signs of increased bleeding if you do decide to take it alongside other medications. Never assume that because something is natural or readily available, that it's automatically safe for you, especially when you're managing other health conditions or taking prescription medications. That open conversation with your doctor about fish oil is absolutely critical to avoid potentially dangerous interactions. Now, moving from the common realm of heart and joint supplements, let's explore another popular one that many people take for various reasons, but which also comes with important considerations as we age. So, we've talked about calcium and vitamin D for bones, and fish oil for heart and joints, and why a doctor's chat is crucial for both, especially as you get older. Now, let's turn our attention to a mineral that has gained a lot of popularity lately and is often taken for things like muscle cramps, sleep issues, anxiety, and even blood sugar control and blood pressure: magnesium. It's an essential mineral involved in hundreds of bodily processes. And it's true that many people, across all age groups, may not get enough magnesium from their diet. Foods like leafy green vegetables, nuts, seeds, and whole grains are good sources. But soil depletion and modern diets can sometimes make it challenging to meet your needs through food alone. Because of its wide range of potential benefits, magnesium supplements have become very common. You might see different forms: magnesium citrate, magnesium oxide, magnesium glycinate, magnesium chloride, each marketed for slightly different purposes or absorption rates. While magnesium is vital, and supplementation can be helpful for some people, especially those with a diagnosed deficiency or specific medical conditions, taking a magnesium supplement without first consulting your doctor is another area where caution is advised for those over 60. One of the primary reasons is, again, the interaction with medications. Many older adults take medications for heart conditions, blood pressure, diabetes, and other chronic issues. Magnesium supplements can interact with several types of medications, potentially altering their effectiveness or increasing the risk of side effects. For example, if you're taking certain antibiotics, such as tetracyclines or quinolones, magnesium supplements can interfere with the absorption of these crucial medications, making them less effective at fighting infections. You often need to take them several hours apart, but knowing the right timing requires knowing about the interaction, which your doctor or pharmacist can explain. Also, some medications for high blood pressure, particularly certain types of diuretics water pills, can either deplete magnesium levels, in which case a supplement might be needed, but only under medical guidance, or conversely, the combination with a magnesium supplement could potentially lower blood pressure too much, leading to dizziness or fainting. For individuals managing diabetes, magnesium plays a role in insulin function, and while some studies suggest magnesium supplementation might help blood sugar control, it needs to be monitored carefully, especially if you're already on blood sugar-lowering medications like metformin or insulin. The combination could potentially lead to hypoglycemia, low blood sugar, if not managed properly. Beyond medication interactions, kidney function is, once again, a major consideration with magnesium supplements. Similar to calcium, the kidneys are responsible for filtering excess magnesium out of the blood. If kidney function is reduced, which is common as we age, the body may not be able to effectively excrete the extra magnesium from supplements. This can lead to a buildup of magnesium in the body, a condition called hypermagnesemia. Symptoms can start subtly with nausea, vomiting, lethargy, and weakness. But in more severe cases, it can cause dangerously low blood pressure, slowed heart rate, difficulty breathing, and even coma. This is a potentially life-threatening condition, and the risk is significantly higher if you have any degree of kidney impairment, even if it's not severe enough to require dialysis. Your doctor can order a simple blood test to check your magnesium levels and kidney function to determine if a supplement is safe for you. High doses of magnesium, particularly in certain forms like magnesium citrate or magnesium oxide, are also well known for causing diarrhea, while this is sometimes used deliberately to treat constipation. Unintended chronic diarrhea can lead to dehydration and electrolyte imbalances, which are particularly risky for older adults. Dehydration can cause dizziness, falls, and put strain on the kidneys and heart. So, while magnesium holds promise for various health benefits, it's not a supplement to take casually when you're over 60. Your doctor can evaluate whether you truly have a deficiency, assess your kidney function, review your current medications for potential interactions, and recommend the appropriate form and dosage if supplementation is deemed necessary and safe. Taking this step ensures that you're using magnesium to potentially benefit your health, rather than inadvertently causing problems due to interactions or impaired excretion. Discussing these 3 supplements: calcium, vitamin D, fish oil, and magnesium, with your doctor before taking them is a crucial step in navigating your health journey safely and effectively as you age. It's all about making informed choices that support your well-being. So, we've explored the importance of talking to your doctor about certain common supplements that are popular but might not be right for everyone over 60, whether it's something you're considering for your bones, your heart, or just general well-being and common complaints like muscle cramps or sleep troubles. It's clear that your body's needs and how it handles things can change significantly as you get older. What might have been perfectly fine in your younger years, or what your neighbor swears by, could potentially interact with your medications, put a strain on your kidneys, or increase your risk of bleeding or other complications. It's not about saying these supplements are inherently bad or that no one over 60 should ever take them. Not at all. For some individuals, under the right circumstances and medical guidance, they can indeed be beneficial. The key takeaway here is that your health profile at this stage of life is likely more complex than it was when you were younger. You might have underlying conditions you're managing, and you're likely taking one or more prescription or even over-the-counter medications regularly. Adding a supplement into that mix without professional oversight is like trying to fix a complex machine without reading the manual or checking if the new part is compatible with the existing ones. Your doctor has the full picture of your health, your history, your current conditions, all your medications, and your latest lab results, like kidney function or mineral levels. They are the best person to help you decide if a supplement is appropriate for you. They can assess whether you genuinely need it. Based on your diet and any deficiencies, they can check for potential interactions with your existing medications, which is absolutely critical for preventing adverse events. They can consider how your body's ability to process and eliminate substances might have changed with age. And they can recommend the safest form and dosage, or suggest dietary changes or other lifestyle modifications that might be more effective or safer for your specific needs. Think of it as building a relationship with your healthcare provider, where you are an active participant. You bring your questions, your intentions, and any supplements you're considering or currently taking. And they provide the expert guidance to ensure everything works together harmoniously for your health. It's a simple conversation, but it's one that can prevent serious issues down the line and give you peace of mind. Don't be afraid to bring the actual bottles with you to your appointment. That can be the easiest way to show your doctor exactly what you're taking or thinking of taking. Taking care of yourself as you get older is a wonderful and empowering journey. It's about making informed choices that support your vitality and independence. Supplements can be a part of that journey for some, but they should never be a shot in the dark or a replacement for professional medical advice. Your health is your most valuable asset, and being proactive and communicative with your doctor about everything you're putting into your body is the smartest investment you can make. Remember, small changes in your approach to health information and decision-making, like having that crucial conversation about supplements, can make a truly significant difference in your overall health and happiness. We hope this has been helpful and shed some light on why that doctor's visit before starting certain supplements is so important. What are your thoughts on this? Have you ever experienced an unexpected interaction with a supplement? Share your experiences or questions in the comments below. Your insights could help others if you found this information valuable. Please give this video a like. It really helps us reach more people who could benefit from this message. And if you want more practical, easy to understand health advice for living your best life at every age, be sure to subscribe to our channel and hit the notification bell so you don't miss future videos. Thank you for watching. And remember, stay informed, stay proactive, and live your best life at every age.